My guest is Trevor Shannon, and he's battalion chief for the emergency management part of our fire EMS department. And Trevor, I want to talk today about something that's on everybody's mind. It's the COVID-19 vaccine. Start by telling us, we know it's going to be administered in phases. What phase are we in now, and when can the general public kind of expect to start hearing more about when they can get it? Talk about that a little.
Sure. So right now we're currently in phase 1B. And if you look at the VDH or the CDC guidance, it gives you a good list of what's included in those phases. So printed off just a real quick reference. So frontline essential workers, people age 65 and up, which that has just changed. So, you know, a lot of people may have heard that it was 75 and up in phase 1B. Recently, the governor announced that that's going to be 65 and up. So currently, as far as the city of Roanoke, the county of Roanoke, Salem City, and all of our local partners, we just yesterday administered vaccines to a lot of our law enforcement personnel, frontline workers, sheriff's departments, and groups like that. Frontline responders and healthcare workers were done in 1A, so we are in that transition phase going to 1B, and then you'll start to see 1C incorporated in the next several weeks.
So it's kind of a fluid situation. As things happen, I mean, more announcements will come out, and the public can expect to hear about when it'll be available for them at some point.
Yes, I think you said it well. With fluid is the word we need to use, because people really need to understand that it changes almost weekly, and we're under guidance from the Virginia Department of Health as well as the CDC and the governor mandates. So we are trying to move through each of these phases, but as things change, we have to adapt and move forward with them.
Okay. Trevor, who is the city partnering with for conducting the vaccination events?
So the biggest partner we have right now is the Virginia Department of Health, and I say that we're also working with each of our locality partners, and so we're trying to form what we're calling quote unquote a task force, and that's going to help us in the planning phase of getting this vaccine, in the arms, as they say. But the Virginia Department of Health has been a great partner. They have brought in a lot of staff that we're getting to know. We spend at least one day a week at the vaccine clinics so that we can get to know their staff and work with them and help coordinate and provide resources that they may need. So we continue to strengthen that relationship, and it is strong right now, but it can only get better. And that's important, because right now we're vaccinating somewhere between maybe 600 to 1,000 people a week, and we plan to be doing much more than that in the near future. So those relationships are critical. It gives us someone to talk to about resources and needs and coordination and all the different things that go into this vaccine effort.
And if somebody who's watching, how can they stay up to date on when and where those events are going to take place?
So there's a lot of resources out there. The Virginia Department of Health, the city of Roanoke, and you can go to roanokeva.gov/vaccinate Roanoke. But we'll provide a list of these resources on the screen here so we can show those resources and people can log in and actually see that. There's Facebook pages available through the Virginia Department of Health, the city of Roanoke, a lot of our local partners, the localities in the city of Salem and county of Roanoke, they all have social media efforts out there for this. So we're trying to do everything we can to get the information out. Another good thing is, talking about the partnerships and how we can share that information, is VDH is working closely with private vendor facilities and other healthcare clinics who could do this vaccine. And so those resources will become available as well, whether it's one of our local clinics in the valley or an independent store, a pharmacy who's going to be doing vaccines. You may get information from them as well. So there's a lot of resources that we're trying to push out, and contact information, you can reach out to one of us and get all of that.
Now, here's a question that comes up a lot. So people who are getting their vaccines, do they need to wear a mask? I mean, they still have to wear the mask. Do they, and if so, why?
Yes, so at least for several weeks, we would ask that they continue to wear the mask. It does take time for the antibodies to build up in the body and build up that immunity in your system. So we would still encourage people to wear the mask. Again, we say that because the masks are so important to prevent this being spread to others, not necessarily from others. So while you maybe have been vaccinated, you're still preventing yourself from spreading the virus to somebody else.
So Trevor, I understand that the city of Roanoke recently got a grant from the Virginia Department of Emergency Management to help us with healthy equity in our community. So talk about how are we going to use that with regard to the COVID pandemic, how those grants will be used to benefit our community?
Yeah, so we're very excited about this grant. It did come from the Virginia Department of Emergency Management, like you said, and it is for health equity. So what we're going to do is this gives us the opportunity to actually have a part-time employee out there on the streets in the community and talking to individuals and seeing how we can get ourselves out in the community and help with whether it's COVID information or vaccine information, where they can get the right protective equipment, things like that. We're gonna build up a system. We have put together a group of people who will talk about this, and it's involving a lot of our local partners and local organizations who are in the community, and just to really enhance the relationship that we have throughout the entire city of Roanoke and build relationships where we don't necessarily have strong relationships now. So while it's going to be COVID related and strictly during the coronavirus pandemic, it's going to build relationships that'll last a long time. So we're excited about the opportunity.
So is there anything else that we haven't mentioned that you think we need to add to what we're saying about the vaccine?
Well, I think it's important that people just understand, and I use the term a lot, patience. This is a new process, a new system for everybody, for myself included, for the Virginia Department of Health and the CDC and all of our partners and organizations that are involved in this. And while we know everybody wants the vaccine and we know there's people out there just waiting to get this vaccine in their arm, we also just need patience so that we can work through the process and really make it effective and an efficient system. Because if it's not efficient, we're going to have just as much frustration at the vaccine clinics as we do right now without getting the vaccine. So I would strongly encourage you to look at the resources that we provide, whether that's on the links below or shared however that is, or reach out to one of the contacts in one of your local localities. It's important that you understand that every week is a new target or a new system in place, and we're all learning as we go. So whether it comes down from the governor's office on a Tuesday press briefing or it's new guidance from the CDC or whatever that might look like, we are working every week to make sure that we include those new changes or modify our systems and try to make the best of this. So like I said earlier, we spend at least one day a week together, and we try to make this system as effective and efficient as possible. But the more patience we have, the better off we are, and we will try to get this thing out there as quick as possible. We understand everybody wants it. We want to get back to some normalcy. We really want to see people back out and having fun with their families and being able to do things without being scared for this virus. So,
and I know that the resource links that we have on the screen also provide information about if you have questions about the vaccine itself. It explains how it works and any risks or that kind of thing. So hopefully people will check those out too.
Yes, absolutely. And there's questions out there, and we know that. We know people are concerned about whether it's which vaccine is it or how long do I have to wait between the vaccines. And I would encourage everyone to look into which vaccine they're going to get. Because there are some differences, and we want you to be aware of what you're going to take as this vaccine comes out. So,
well, it's really important information, and I appreciate you sharing it with us today.
Certainly. Thank you for the opportunity.
Thank you.